So when we think about who this caregiver is that you guys may be seeing in your care coordination and your Healthy Families work, what do they bring to this relationship that could be worrisome, and what are some of the risk factors for that? One of the things is that there is a lot of things that happen, as you guys probably know better than I do, during pregnancy that are psychological tasks. The first thing of which is to acknowledge that you're pregnant, right? And to, Reva Rubin talks quite a bit. Are you guys familiar with the work of Reva Rubin? She talks quite a bit about, what's normal and what's not normal during those stages. And one of the things that happens is that the baby is not a separate individual in the beginning. Especially before you've felt movement. It's kind of all blended in your concept of I'm having a baby. But we need to go through a task of being able to kind of separate and see that this is an individual life separate from mine. This is somebody that is eventually, going to have thoughts and feelings and actions that are separate from me. And what's a population that, as I'm saying that sometimes has problems with that, is teen mothers. Sometimes have a hard time differentiating that this child is not merely an extension of me, but they're a very different individual with very different thoughts and feelings. And so I think that when there's been difficulty accepting the pregnancy, or flat out, I wanted an abortion and I wasn't able to come up with the money or something like that, that can be a risk factor for later being able to be in relationship with that baby. Doesn't mean it's always going to be a problem, but it could be a risk factor. Would you guys agree? That I want to tell you just real quickly, and I'll try, because I know we only have an hour, but how I got interested, I just got done telling this story earlier, in infant mental health was back in the late 80s when I was doing an internship. I was told, Stacy, go over to the emergency room. It was in a hospital much like this. Go over to the emergency room, and there's a mom there who's something happened, and I don't quite know the whole story, but she had a baby, and you need to get over there. So I get over there and everybody's talking about it, and they're like, you need to go in there. And they actually were trying to kind of they were laughing like, what's Stacy going to do with this? So I walked into the room with this mother who apparently was in her mid 30s or low, she was like 30, 35, she wasn't young. She was an attorney. She seemed well put together. And she looked at me and I said, oh, I'm from the social work department. And she said, you need to help me because, people keep coming in here and saying that I had a baby, and I don't know what happens. I wasn't all with it, but I came in with a stomach ache, and now they're trying to say he's my baby. I don't know what's going on here. And you can imagine how I was. I was kind of like, okay, is everybody, is this a joke? I said, so you don't think this is your baby? I ended up, I remember kind of like whispering it to her, like, so you don't think this is your baby? I had a sense that she was pretty flipped out. She was psychotic, but there was also a lot more to this. So what got me interested is my practicum instructor, my internship instructor, saying that in response to me being very concerned, what are we going to do? What about this mother and baby? And she said, well, we'll give her a big, kick of Haldol, and it'll kick in and she'll be okay, and the DHS or whatever it was called in Missouri, they'll intervene, but and I said, well, wait a minute, who's going to help this mom and baby? This seems pretty loaded with problems. For one, do you think she has a crib? And so she said, well, we're going to really see some problems when he goes to school. And I was like, this is messed up, but, what am I thinking, So I later found out that there was a field to help with these kind of things. So that was a risk factor, would you not agree? So, but also, how many people have heard this? When the pregnancy has been difficult, it is hard for mothers, as much as they can think, and not, that this is ridiculous, but I'm a little frustrated with my baby, or I feel like this has been a difficult experience. Not always do those words come out, but I think that especially when the pregnancy has been filled with lots of stress, and sometimes the source of the stress has been the baby, the fact that you're pregnant and I didn't want a baby yet, says the father, causes puts the mother in a much different place than if they were fully supported through that pregnancy. So mental health conditions throughout the pregnancy, when there's anxiety and depression, and the work of managing the psychological tasks of pregnancy are derailed by my trying to focus on the fact that I need to, eat better. I'm so depressed I can't eat, sleep, so we need to think about those things. And most people, as Reva Rubin points out, will say, am I going to be a good mom? Most people go through that. But when it becomes a primary concern that I'm not going to be able to do this, or I had a horrible past, I have worked with many people who have said, I'm going to hurt my kid, even though I don't want to be like my mom, I'm going to be abusive. Those are things, actually that's a good thing that they're able to verbalize that. It's when they can't verbalize it that we're more concerned. But those are all risk factors. When there are unresolved issues related to childhood experiences, I've had many women say to me, and men, that just because I've been abused as a child doesn't mean I'm going to do it again, and I'm sick and tired of people acting like I'm a risk factor because because I told you I was abused. Well, you know what I've said back to them is good for you for pointing that out, because it's the people that deny that this was a difficult experience. It's Yahoo when they remember it and talk about it. That is a wonderful thing, and better yet when they can link it to those effective memories and be able to say things like, yeah, you know, my dad, you know, would hit me when he would come home from drinking, and I remember the pain that felt and the embarrassment when my friends found out about it, and gosh, I'm never going to do that. I know you might think I'm going to do that, but I don't want my child to ever feel that. That's somebody who we're very likely to not see repeat the pattern, versus somebody who says, yeah, my dad was a good guy, and yeah, he was there for us, and well, can you tell me about that? And, well, I don't know, he was there for us. That's a different story. So, loss of a parent, you know, at any stage in somebody's development will come back to life during pregnancy, you know. So, and during the birth, you know. I mean, I think that this happens for a very important reason, that we reflect on our parenting experiences when we have that experience and when we go through that. And I think that we would have no idea as an individual that something might come up for us until it happens. We might go through life looking very functional, but boy, when that baby comes, we're a different person. We are now projecting onto that baby experiences that we might have not even had conscious awareness of. So reflecting on that, and when there's been a loss, and especially an unresolved loss, we often will see that to be a big barrier to a nice attachment. The previous loss of a child, especially again when that has not been processed, can be a risk factor for a parent forming a bond with another child. And I think that that doesn't mean that always has to be a difficult situation. But I've worked with many people that have adopted kids after some traumatic losses, and you know, one example that comes to my mind is a mom who had a stillborn baby, and then she had a baby that at age 3 died of neuroplasmosis, no, what's it called, fibromatosis or something, yeah, something like this, some kind of, and so she not only had a picture of him on the mantle, she had a shrine to this little boy on the mantle, and she had her now adopted child that would say prayers to him and all. It was just, you know, and I felt so sorry for the blood, and he was trying so hard to get to her, and she just couldn't get there, you know. She was still so hurt by that. So poor relationship with partners is a big risk factor. We know one of the most important things that when people do have postpartum depression, they often talk about relationship issues with their partner as being one of the stressors that will sometimes lead to that. And then, of course, absence of support, or even a perceived absence of support, is important.